Restless leg syndrome. Restless leg syndrome is a sleep-related movement disorder that involves an almost irresistible urge to move the legs at night. This urge tends to be accompanied by unusual feelings or sensation of paresthesia that occur deep in the legs. These uncomfortable sensations often are described as a burning, tingling, or jittery feeling. The symptoms of restless leg syndrome worsen when lying or sitting and can be relieved at least temporarily and immediately by walking or moving the legs. The urge to move the legs increases in the evening or at night, with relief tending to arrive in the morning. Onset occurs at all ages, from early childhood to late adult life. In children, restless leg syndrome often is misdiagnosed as growing pains because those are too young, doesn't describe the unpleasant sensation involved with restless leg syndrome accurately. So most of children are diagnosed as a growing pains. Symptoms may vary widely from one day to the next, and they are provoked by long periods of inactivity. Symptoms are most common in the legs, but may progress to the arms and other parts of the body. In mild cases, restless leg syndrome may occur with greater regularity and long periods of remission. People with restless leg syndrome often have periodic limb movements, a closely related sleep disorder that occurs when muscles involuntarily twitch, or flex while you are still sleeping. Periodic limb movements in sleep occur in 80 to 90% of people with restless leg syndrome. When we see the types of restless leg syndrome, there are early onset and late onset restless leg syndrome, and also primary and secondary restless leg syndrome. Early onset restless syndrome starts before the age of 4 to 5 years, producing symptoms that progress gradually. The daily occurrence of symptoms usually is not present until the age of 40 to 65 years. So this starts gradually, and most of the time earlier there is no daily symptoms. It is intermittent. Whereas late onset restless leg syndrome advances more quickly and occurs more often. Symptoms may appear daily from time that they begin, or they may progress rapidly over a period of about 5 years until they occur with regularity. So late onset restless leg syndrome advances more quickly than early onset one, and it occurs more daily than that of early onset. The other classification is primary and secondary. The primary one occurs independently of other disorders that might be exacerbated or triggered by other factors, whereas secondary is precipitated by other disorders and resolves when the other disorders are treated. Let's see risk groups. The first is gender. Women are between 1.5 times to 2 times more likely than men to have restless leg syndrome. Treatment for restless leg syndrome usually is more common in the older age group. The other is iron deficiency. Iron deficiency and all conditions that produce iron deficiency increase the risk of restless leg syndrome, with iron deficiency appearing to be a common factor for most secondary causes. So, the most common cause of secondary restless leg syndrome is iron deficiency. In this case, brain iron deficiency might be a primary pathology of restless leg syndrome. The others are drugs. Several medications may precipitate or aggravate restless leg syndrome, including non-prescription allergy and cold medications that contain antihistamines and most antidepressants. The other is family history. First relatives of a person with restless leg syndrome are 3 times to 6 times more likely to have it. More than 50% of people with primarily restless leg syndrome report a pattern of a disorder in their family. Secondary restless leg syndrome clearly has been shown to exist in pregnancy and end-stage kidney disease. So pregnancy and end-stage kidney disease are the common cause for secondary restless leg syndrome next to iron deficiency. Let's see the effects of restless leg syndrome on the person's life. Restless leg syndrome often causes a reduction in daytime energy, and increased rates of depression and anxiety have been reported for people with restless leg syndrome. Restless leg syndrome symptoms can cause severe sleep disturbance. It can hinder a person from being able to go to sleep or return to sleep after awakening. This is in the severe form of it. Mild form of it, it might cause mild disturbance in sleep. Repeated leg movement during the night also disturbs the sleep of the bed partner. If somebody is sleeping with that person, it might be disturbed also. Let's see the treatment of restless leg syndrome. For mild cases of restless leg syndrome, symptoms may improve with the implementation of a regular daytime exercise program. The use of hot baths, leg massage, and heating pads also may reduce symptoms. It is also important to avoid drinking alcohol in the evening. Although alcohol can decrease the time it takes to fall asleep, it leads to more awakening during the night. This can exacerbate the awakenings that occur because of restless leg syndrome. Restless leg syndrome patients with low ferritin levels may see symptom improvement by increasing iron stores in the body through oral or intravenous iron supplementation. So iron therapy is very important if there is iron deficiency. Let's see the pharmacological management of restless leg syndrome. Restless leg syndrome is often treated with one of these types of medications. The first line is dopamine agonists. Dopamine agonists are considered the first line of treatment for restless leg syndrome and commonly are used to treat Parkinson's disease. They affect the brain's level of dopamine, a neurotransmitter that plays a critical role in the functioning of the central nervous system. The other is benzodiazepines. These drugs are much less effective at reducing the symptoms of restless leg syndrome compared to that of dopamine agonists, but they do improve sleep quality. Small dose of benzodiazepines may be used to counteract the stimulating effect that can result from dopamine agonists. The third one is anticonvulsants, especially gabapentin. This is considered less potent than the dopamine agonists. The gabapentin remains an effective option in mild cases of restless leg syndrome for people who are unable to tolerate dopamine agonists. It also can be useful for restless leg syndromes who experience painful sensation. The others are opioids. Just narcotic pain relievers are used most often for patients with severe cases of restless leg syndrome that do not respond to other treatment. Thank you for watching.